These are the instruments for CS or cesarean section. So we have three cleaners called sponge holding forceps. One on top of the Savlon solution, another one on top of the spirit or the povidone iodine solution, and swab on stick. So the swab on stick is used to do inspection. Once you put the uterus back to its normal position, we want to inspect there to see there is no bleeding coming from that part again. We also have green amytage, three of them. Green amytage, the tip is what? Flat. So it wouldn't cause any bleeding, harm to the uterus. It is used to arrest bleeding on the uterus because the uterus is what? Highly vascularized. Anywhere you see the bleeding coming from, then what? You clamp it like this. So we also have two clamps for clamping the cord. Once the baby comes out, we clamp the cord and what? We cut it. Two clamps. We also have Lane's tissue forceps. So Lane's tissue forceps has a tooth. So that means that it is meant for what? Tough tissue. Lane's tissue forceps. We also have 4 artery forceps. 4 artery forceps, 2 straight, 2 curved. And we also have 2 types of dissecting forceps. Plain dissecting forceps and 2 dissecting forceps. The plain one is meant for soft tissue and the 2 dissecting forceps is meant for what? Tough tissue. Any instrument with tooth is meant for tough tissues. We also have 2 types of scissors here. The straight scissors and the curved scissors. Straight scissors is called the cutting scissors and the curved one is called the surgical or the surgeon's scissors. And we have the scalpel with braid. So what? Scalpel braid or braid handle. Then we have our towel clips. Once we drape the patient, this is the instrument that we are going to use to what? To hold the towels so that they will be able to be in their best position. We have 2 types of retractors. The Rous retractor and the bladder retractor. We have 2 types of bladder in the human body. We have the gallbladder and the urinary bladder. So this is meant to separate or retract the bladder from the uterus because the urinary bladder is just at the base of the uterus. And lastly, we have the delivery forceps or the Wrigley's forceps. Once we cut and the baby's head is exposed, this is what we are going to use to pull the baby's head out. The Wrigley's or the delivery forceps. And of course, we have the kidney dish and also the gallipot and our big bowl for containing the gauze and our pack.